Have you ever been reading a favorite book and suddenly the words start to blur together just for a moment? Or maybe you've looked up to see a loved one's face across the room and it wasn't quite as sharp as you remember. You probably sighed and thought, well, this is it. This is just part of getting older. We're told that our vision is supposed to fade, like an old photograph left in the Sunday. But what if I told you that for many of us, that creeping blurriness, that frustrating lack of clarity isn't just about the number of birthdays we've had? What if the real culprit is something else entirely, something hiding in plain sight in our daily routines? What if you could actually make your vision sharper, clearer, starting today with a few simple changes? It's a frightening thought, isn't it? The idea of our world slowly losing its focus. The fear of not being able to drive at night, of not recognizing a friend from a distance, or not being able to see the tiny, beautiful details of life. We often accept it as inevitable, but the truth is, while our eyes do change with age, much of the frustrating blurriness we experience is actually a distress signal, a warning sign from our body about other things that are out of balance. These are things that are very often within our power to control. In this video, we're going to pull back the curtain on what's really causing that frustrating blurriness. We'll uncover 5 of the most common yet overlooked culprits that have nothing to do with needing a stronger pair of glasses. More importantly, we're going to give you simple, practical, and powerful strategies to fight back, to help you protect your precious eyesight and see your world with the clarity you deserve. Before we dive in, if you believe that your health is your most valuable asset and you're committed to protecting it as you age, consider subscribing to our channel and turning on all notifications. We share the kind of health wisdom that can genuinely change your life. Insights that often get overlooked in a quick doctor's visit. And I'm always so curious to know who I'm speaking with today. Are you watching from the United States, from Canada, the UK, Australia, or somewhere else entirely? Please take a moment and drop your country in the comments below. It's wonderful to see how far our community of health-conscious seniors reaches. All right, let's get started. The first hidden cause of blurry vision is so simple, so fundamental, that almost everyone overlooks it. It's not a disease. It's not a scary diagnosis. It's chronic, low-grade dehydration. Yes, not drinking enough water. Now, you might be thinking, dehydration? That's for athletes or people working in the hot Sunday. I drink when I'm thirsty. But here's the secret. As we get older, our body's thirst mechanism, that little signal that tells us we need a drink, it becomes less reliable. We can be mildly dehydrated and not even feel thirsty at all. Think about your eyes for a moment. They are incredible, complex organs, but at their core, they are largely made of water. The clear gel inside your eyeball, the vitreous humor, is 99% water. The lens, which does all the focusing, needs to be perfectly hydrated to bend light correctly. When you don't have enough water in your system, your body starts to pull water from less essential areas to protect your vital organs like your heart and brain. And unfortunately, it often borrows that water from your eyes. When this happens, the lenses in your eyes can actually shrink and lose their flexibility. They can't focus properly, and the result is blurry vision. It's like trying to look through a camera lens that's slightly warped. On top of that, dehydration is one of the leading causes of dry eye syndrome. Your tears aren't just salty water. They're a complex film that protects, cleans, and lubricates the surface of your eye. Without enough water, you can't produce enough quality tears. Your eyes become dry, gritty, and irritated. And that dryness creates a rough, uneven surface on your cornea that scatters light instead of focusing it, leading directly to blurriness. Have you ever felt that sandy, scratchy feeling in your eyes at the end of the day? Or noticed your vision seems to fluctuate, clear one moment and fuzzy the next. That is a classic sign of dehydration-induced dry eye. It's a quiet problem that builds over time. You might not notice it day to day, but week after week, month after month, this chronic lack of hydration puts an enormous strain on your eyes. The good news is that this is perhaps the easiest problem to fix. You don't need a prescription, you just need a new habit. Don't wait until you feel thirsty. Make hydration a conscious part of your day. Keep a water bottle with you at all times. A great little trick is to set a goal of finishing one bottle by lunchtime and another by dinner time. If you find plain water boring, infuse it with a slice of lemon, a few cucumber slices, or a sprig of mint. Herbal teas with no sugar also count. The goal isn't to suddenly start chugging a gallon of water a day. It's about creating a consistent, steady intake. Start by adding just 2 more glasses of water to your daily routine than you're having now. Just that small change can have a remarkable impact. Within a week, you may notice your eyes feel more comfortable, less strained, and that nagging intermittent blurriness starts to fade away. You're not just quenching your thirst, you're re-inflating and nourishing the very lenses that allow you to see the world. Now, let's move on to our second major culprit. And this one is tied directly to what's on your plate. I'm talking about the blood sugar roller coaster. Many people associate blood sugar issues only with diabetes, but the truth is, even if you haven't been diagnosed with diabetes, frequent spikes and crashes in your blood sugar can wreak havoc on your vision. Here's why. The lens inside your eye is a living tissue, and it's incredibly sensitive to the level of sugar or glucose in your bloodstream. When your blood sugar spikes high, which can happen after eating refined carbohydrates like white bread, pasta, sugary cereals, or drinking a big glass of fruit juice, your body tries to balance things out. Some of that excess sugar is drawn into the lens of your eye, and it pulls water in with it. This causes the lens to physically swell up. When the lens swells, it changes shape, and when it changes shape, it changes the way it bends light. Your eye's focus is thrown completely off, and your vision becomes blurry. This is why one of the very first symptoms of undiagnosed type 2 diabetes is often blurry vision. But you don't need to have full-blown diabetes to experience this. Even if you are pre-diabetic or simply eat a diet that causes these frequent ups and downs, your vision can suffer. Have you ever eaten a big pasta dinner or a sweet dessert and then an hour or two later noticed it was harder to read the TV guide or a text message? That's not your imagination. That's the swelling in your eye's lens in real time. Then, as your insulin works and your blood sugar levels come down, the water is pulled back out of the lens and it shrinks back. This constant swelling and shrinking puts an immense physical stress on the delicate structures of the lens. Over many years, this process can damage the proteins within the lens, causing them to clump together and become cloudy. This damage is a direct contributor to the formation of cataracts. So controlling your blood sugar isn't just about avoiding diabetes. It's one of the most powerful things you can do to prevent cataracts and keep your lenses clear for years to come. So, what can you do? The key is to get off the roller coaster and aim for stable, gentle blood sugar levels throughout the day. This means being very mindful of refined carbohydrates and hidden sugars. That glass of orange juice you think is so healthy, it's basically sugar water without the fiber to slow its absorption, causing a massive sugar spike. Swap it for a whole orange instead. That white bread toast in the morning, it digests almost as quickly as pure sugar. Switch to a true 100% whole grain bread that's packed with fiber. The goal is to focus on whole foods, lean proteins, healthy fats, and lots of non-starchy vegetables. When you eat a balanced meal, the energy is released slowly and steadily into your bloodstream. There are no dramatic spikes, no swelling of the lens, and no stress on your eyes. It's a simple shift in focus from processed and fast digesting foods to real whole foods that nourish your body and protect your sight. Think of it as choosing the calm, scenic route for your body instead of the jarring up and down roller coaster. Your eyes will thank you for the smooth ride. If you're finding this information eye-opening so far, please take a moment to press the like button. It's a small click for you, but it makes a huge difference in helping this video reach other seniors who might be worried about their vision and don't have this information. Your support truly helps us spread this vital knowledge. Now for our third surprising cause of blurry vision, and this one might be sitting right in your medicine cabinet. I'm talking about the side effects of common medications. As we get older, many of us are on one or more prescription medications to manage conditions like high blood pressure, allergies, depression, or arthritis. These medications can be life-saving, and it is absolutely crucial that you never stop or change a medication without talking to your doctor. However, it's also important to be an informed patient and to understand that many of these widely prescribed drugs can directly impact your vision. A huge number of medications, including diuretics or water pills for blood pressure, antihistamines for allergies, antidepressants, and even some pain relievers have a common side effect. They can cause dryness throughout the body. And as we learned with dehydration, when your body is dry, your eyes are among the first to suffer. These drugs can reduce your tear production, leading to that gritty, blurry, dry eye we discussed. But it goes beyond just dryness. Some medications can affect the muscles that control your pupil or the focusing muscles of your lens. For example, some antidepressants and medications for overactive bladder can cause your pupils to dilate, making you very sensitive to light and causing blurry vision, especially up close. Other drugs can affect the pressure inside your eye or, in rare cases, cause deposits on the cornea or swelling in the retina. It's a long and complicated list. The problem is, when we start experiencing blurry vision, we rarely connect it to the pill we've been taking every morning for the past 5 years. We blame age. Our doctor might blame age, but it could be a solvable side effect. I want to tell you a quick story about a gentleman named Arthur. Arthur was in his late 70s and an avid reader. Over about 6 months, he found reading incredibly difficult. His vision was blurry, his eyes felt tired and strained, and he was getting headaches. He got a new, stronger pair of reading glasses, but it didn't help. He was getting very discouraged. During a routine checkup, he happened to mention it to his doctor, almost as an afterthought. The doctor looked at his chart and saw that about 7 months prior, he had been started on a new medication for high blood pressure. On a hunch, the doctor checked the side effects, and sure enough, blurry vision and dry eye were listed. The doctor didn't take him off the medication, but he did prescribe some therapeutic lubricating eye drops and suggested Arthur also get a humidifier for his home. The change was not overnight, but within a month, Arthur's symptoms had improved dramatically. He was back to reading his beloved books, all because he and his doctor connected the dots. The lesson here is to become a proactive partner in your own healthcare. The next time you visit your doctor or pharmacist, take a list of all your medications with you, including over-the-counter ones. Ask them directly, could any of these be contributing to my blurry vision or dry eyes? There may be an alternative medication in the same class with fewer visual side effects. Or, like in Arthur's case, there might be simple supportive treatments that can counteract the side effect without changing the essential medication. Knowledge is power. Don't just assume that blurriness is an unavoidable part of aging. It could be a manageable side effect waiting to be identified. Moving on to our fourth culprit, which we can think of as the starved eye. Your eyes, particularly the retina at the back of your eye, are some of the most metabolically active tissues in your entire body. The retina is packed with millions of photoreceptor cells that are constantly working, turning light into neural signals. To do this incredible job, they require a massive and continuous supply of oxygen and specific nutrients delivered through a network of tiny, delicate blood vessels. If that supply chain is compromised, your retinal cells can't function properly and your vision will suffer. This is where your overall cardiovascular health comes into play. High blood pressure, high cholesterol, and atherosclerosis, which is the hardening of the arteries, don't just affect your heart. They damage these tiny blood vessels throughout your body, including the ones in your eyes. When these vessels become narrowed or blocked, they can't deliver enough oxygen-rich blood. This can lead to a condition called retinopathy, which is damage to the retina that causes blurry vision, floaters, and even blind spots. But it's not just about blood flow, it's also about what's in that blood. There are specific antioxidant nutrients that are absolutely critical for eye health. They act like internal bodyguards, protecting your delicate eye tissues from damage caused by sunlight and metabolic waste. The two most famous are lutein and zeaxanthin. These are pigments that accumulate in the macula, the part of your retina responsible for sharp central vision. They act like internal sunglasses, filtering out harmful blue light. Studies have shown time and again that people with high levels of lutein and zeaxanthin in their diet have a much lower risk of developing age-related macular degeneration, a leading cause of vision loss in seniors. Another crucial nutrient is omega-3 fatty acids, particularly DHA, which is a major structural component of the retina. Omega-3 seconds are also powerfully anti-inflammatory, which helps protect those tiny blood vessels. Vitamin C and E, and the mineral zinc are also vital for slowing down oxidative damage. When your diet is poor in these nutrients, your eyes are left defenseless. It's like trying to maintain a beautiful, delicate garden without providing any fertilizer or water. Over time, it will wither. You might not notice the effects from one day to the next, but the cumulative damage over years is what leads to serious age-related eye diseases. The solution is to feed your eyes from the inside out. Make it a mission to eat a rainbow of fruits and vegetables every day. Lutein and zeaxanthin are found in abundance in dark leafy greens like spinach, kale, and collard greens, as well as in yellow and orange vegetables like corn and bell peppers. For your omega-3 seconds, fatty fish like salmon, mackerel, and sardines are the best sources. If you don't eat fish, a high-quality algae-based omega-3 supplement can be a good alternative. For vitamins C and E and zinc, think citrus fruits, berries, nuts, and seeds. You don't need to follow a perfect diet, but every time you choose a handful of spinach over a bag of chips or a piece of grilled salmon over a processed meal, you are actively delivering the building blocks your eyes need to stay healthy and clear. You are investing in your future sight with every bite. All right, we've arrived at our fifth and final culprit, and it's one that has become increasingly common in our modern world, even for seniors. It's the modern menace of digital eye strain. 20 years ago, this was a problem mostly for office workers. But today, we are all spending more and more time looking at screens. We use computers to pay bills and connect with family, tablets to read the news, and smartphones to see pictures of our grandchildren. These devices have opened up the world, but they also place a unique kind of strain on our eyes that they were not designed for. When you look at a screen, you are staring at a fixed distance for long periods. The tiny ciliary muscles inside your eyes have to remain contracted to hold that focus. Imagine holding a small weight with your arm outstretched for hours on end eventually. Your arm muscle would cramp up and get exhausted. The same thing happens to your eye muscles. This is called accommodative spasm, and it can leave your eyes feeling tired, sore, and unable to relax and focus properly on other distances, resulting in temporary blurry vision. Furthermore, we tend to blink much less when we're staring at a screen, sometimes up to 60% less often. Blinking is what spreads that protective layer of tears across your cornea. Less blinking means more evaporation and, you guessed it, more dry eye, which adds to the blurriness. Then there's the issue of blue light emitted from these screens, which can contribute to eye fatigue and may, over the long term, cause damage to retinal cells. It's a triple threat: muscle fatigue, dryness, and blue light exposure. This is why after an hour of scrolling on your tablet or watching videos on your phone, you might look up and find the entire room seems out of focus for a few moments. Your eye muscles are essentially locked up and need time to relax. Over time, this chronic strain can lead to persistent headaches and a feeling that your vision is just getting progressively worse. But you don't have to give up your devices. You just need to use them more smartly. The most important rule to adopt is the 20-20-20 rule. It's simple. For every 20 minutes you spend looking at a screen, take a 20-second break to look at something that is at least 20 feet away. This forces your focusing muscles to relax, preventing them from getting locked up. Set a timer on your phone or put a sticky note on your screen to remind you. It's a tiny habit that makes a world of difference. Also, pay attention to your environment. Make sure the room is well lit to reduce glare on the screen. Adjust the brightness and contrast on your device to a comfortable level, and consider increasing the font size so you're not squinting. Lastly, make a conscious effort to blink fully and frequently while you're online. It might sound silly, but it's a powerful way to keep your eyes lubricated and comfortable. By managing your screen time intelligently, you can enjoy all the benefits of technology without sacrificing the health of your eyes. So, to quickly recap, we've seen that blurry vision in our senior years is so much more than just an inevitable consequence of aging. It's a signal. It can be a signal that you need more water, a signal that your diet is causing blood sugar instability, a signal to review your medications with your doctor, a signal that your eyes are starving for specific nutrients, and a signal that you need to give your eyes a rest from the demands of our digital world. Now, I know this can feel like a lot of information. It might even be a little unsettling to learn that things you've been doing every day could be affecting your sight. But please hear this. This is not a reason to feel guilty. This is a reason to feel empowered. Knowledge gives you the power to make new choices. You now understand the hidden forces that can cloud your vision, and you have the simple, practical tools to fight back. Growing older doesn't mean we have to accept the slow decline. It means we have to be smarter, more conscious, and more deliberate about how we care for these amazing bodies that have carried us through life. The clarity of your vision is profoundly linked to the health of your entire body. I know it can be scary. The thought of losing your independence, of not being able to see the world clearly, is a deep-seated fear for many of us. But you are not helpless in this. You are the one in the driver's seat. Every glass of water you drink, every healthy meal you choose, every conversation you have with your doctor, every 20-second break you take from your screen, it is an act of defiance against decline. It is a powerful statement that you value your health, your independence, and your ability to witness the beauty of the world. One small step at a time, one good choice at a time. You are protecting your precious gift of sight. Now, I would truly love to hear from you. Which of these 5 hidden culprits surprised you the most? Was it the idea that a glass of water could clear up your vision, or that a common medication could be the cause? Please share your thoughts and any of your own experiences in the comment section below. I do my best to read every single one, and our community learns so much from each other's wisdom and stories. If this video has helped you in any way or given you a new perspective, please show your support by giving it a thumbs up. It truly means the world. and it helps YouTube show this video to other seniors who need to hear this message. And if you haven't already, make sure you subscribe to the channel and click the notification bell. We have so much more to share to help you live your senior years in the best health possible. Finally, if you're still with me and you are feeling determined to take active steps to protect your vision, please type a 1 in the comments. It's a way of making a small commitment to yourself and affirming that you're ready to take control. Thank you so much for spending this time with me today. Stay strong, stay healthy, and keep your eyes open to all the wonderful moments life still has to offer.